Thank you for watching this Counseling Center introductory training on responding to mental health crises. While reviewing the video, please take notes and track lingering questions you might have that we can answer in the upcoming Campus Connect suicide prevention training. The Counseling Center is located in the Humanities Building in Suite 150. There is an entrance at the base of the turret tower and an accessible entrance with elevator access in the courtyard between the Philosophy and Theology departments and next to the Center for Community, Service, and Justice. The Counseling Center is committed to supporting students in their growth and learning through developmentally oriented mental health services. We are a free and confidential resource for undergraduate and graduate students at Loyola. Our mission is inspired by the core values of our Jesuit university to encourage lifelong learning, development of the whole person, self-reflection, values clarification, and spiritual growth in a diverse and changing world. As members of the Loyola community, the Counseling Center strives to also consider the impact of injustice, oppression, privilege, and discrimination on the Loyola community as we seek to provide services that meet the needs of all Loyola students. We encourage you to learn more about the Center's mission and commitment to social justice by visiting the Social Justice tab on the Counseling Center website. The Counseling Center's team includes our administrative team, licensed clinicians, and advanced doctoral externs who have been trained in a range of mental health fields, including psychology, clinical social work, psychiatry, and professional counseling. You can learn more about each member of our multidisciplinary clinical and administrative team on our website under the About tab. We often work with individuals who are adjusting to college or navigating various mental health concerns. Some common student concerns that might prompt a visit to the Counseling Center are homesickness, anxiety, roommate conflicts, relationships, family concerns, sexual assault, suicidal thoughts, racial trauma or other identity-based traumas, self-esteem, and more. The Counseling Center offers both in-person and telehealth services that are outlined in more detail on the available services portion of the Counseling Center's website. Counseling Center services are tailored to fit the needs of each student. Students who are interested in counseling may schedule an initial assessment appointment to discuss their mental health needs and determine the most appropriate treatment options for them. Depending on the needs of the student, there are several resources of support that can be considered. Students can also schedule a one-visit Let's Talk appointment with a counselor or a consultation session to discuss concerns about another Loyola student. The Counseling Center also has a number of online resources that can be accessed through our website. One exciting addition is TogetherAll. TogetherAll is an anonymous online peer support resource where you can find resources for coping with mental health concerns and connect with other people seeking support. The platform is free to Loyola students and is monitored by clinicians to maintain the safety of the space or respond to posts that indicate concerns for risk. Now I'd like to share a little bit more about each of the Counseling Center's services. Our Let's Talk sessions are intended to provide a one-time space for students to discuss a specific concern and identify strengths, solutions, and resources to consider moving forward. Our workshops are facilitated by a counselor or psychoeducation group facilitator, and they offer helpful information about mental health to provide useful strategies for participants to increase their emotional awareness, reduce stress, and incorporate new coping skills into their daily routines. Some of our workshops include Recognition, Insight, and Openness, also known as RIO, a 3-session live workshop that incorporates mindfulness, acceptance, and values exploration as internal resources for managing anxiety and other strong emotions. RIO will be offered on numerous occasions throughout the semester. Give us a call at 410-617-2273 to learn more. The Mindful Self-Care Workshop is a one-session live workshop that provides support in creating an action plan for self-care and learning basic relaxation techniques. The Mindful Self-Care Workshop will be offered monthly throughout the semester. Check out the Counseling Center event calendar located on our website or the bridge for scheduling and workshop location. We also have brief pre-recorded workshops available, such as a recorded journaling workshop that introduces the benefits of journaling and provides prompts for students to explore their thoughts and feelings. Group counseling is also offered by the Counseling Center. Groups provide a place for undergraduate and graduate students to come together and learn new skills, receive support, share information and resources, and process interpersonal dynamics. Group counseling can often be the most effective counseling intervention. Some examples of the groups offered by the center include Empower, a support group for students of color, In, Out, and In Between, a support group for LGBTQ+ students, the Grief and Loss support group, and Understanding Self and Others, a therapy group focused on interpersonal dynamics and group process. Groups are facilitated by 1 to 2 counselors and typically run weekly for the duration of the semester or academic year. Brief individual counseling is also offered at the Counseling Center. In brief individual counseling, a student meets with a counselor to explore emotional, social, or educational concerns. Goals of individual counseling may include resolving problems, adjusting to new or challenging life circumstances, improving academic skills, enhancing relationships, addressing the impact of discrimination, and increasing life satisfaction. The Counseling Center provides individual counseling based on a brief model to effectively manage demands for services. For individual counseling, students will complete an informed consent prior to engaging in counseling services. Some students experience longer-standing challenges which are most fully addressed in more open-ended counseling than the Counseling Center can provide. When off-campus therapy is recommended or preferred by a student, a counselor can provide several referrals selected specifically for the student and tailored to their concerns. Comprehensive referral support may include helping students access health insurance options, providing the student with the name of counselors, and supporting the student in identifying needs and preferences to ensure therapist fit. We encourage any student to reach out to us to learn more about our services or get connected to support. In addition to our clinical services, the Counseling Center provides outreach, consultation, and public health campaigns to the campus community. These prevention efforts seek to improve the emotional and interpersonal well-being of the Loyola community by providing educational programming, promoting community awareness of mental health, and offering consultation on topics such as stress management, grief and loss, body image, helping skills, resilience, suicide prevention, and cultural identity awareness. As noted in our mission, the Counseling Center strives to consider the impact of injustice, oppression, privilege, and discrimination on the Loyola community as we seek to provide services that meet the needs of all Loyola students. In addition to working with campus partners such as Alana Services, The Collective, Disability Support Services, and more, our staff engage in semesterly training and professional development that centers the intersection of multicultural identity and justice issues in our work as mental health providers. We encourage you to check out the webpage that outlines our justice initiatives, and we welcome your feedback as we continue to grow in this area. You might be wondering how you can encourage a friend, mentee, or peer to seek support. There may be times when you notice feeling concerned about someone. For example, they may be missing classes, withdrawing from friends, getting into frequent arguments, worrying often, or expressing thoughts of suicide or dying. These might be cues to help them get connected to support. Here are some things you can do as a source of support. Make time to express your concerns. Use I statements, and without judging the person you care about, express how you feel. You might say, "I'm worried about how sad you seem. I want to be able to offer you my support." Once you've expressed your feelings, Encourage the person to talk and then really listen. Reflect back what you're hearing to help clarify the problem. You can use open-ended questions to encourage sharing and resist problem solving until the student is ready. Sometimes you can explore resistance to help seeking by saying something like, "What has gotten in the way of getting help?" Or, "Could it be worth taking this step even though it's really difficult?" Make sure you don't take on being a source of support alone. You may not feel qualified to help the person with their problems, and we can identify multiple resources for support, including the Counseling Center, the study, campus ministry, class deans, Alana Services, and other relevant offices. Refer those you're concerned about to the Counseling Center by offering to call with them to make an appointment, by showing them the resources offered on our website and consulting with a counselor or administrator about other ways you can offer support. It's particularly important to connect a student to support when they're experiencing a mental health crisis or situation in which their behavior puts them at risk of hurting themselves or others and/or prevents them from being able to care for themselves or function effectively in the community. If you'd like more support in navigating how to help someone you know or how to connect students to the Counseling Center, please don't hesitate to reach out to consult with a counselor. Cognito is also a great resource for developing helping skills. This free online module is located on the Counseling Center website. We encourage you to give us a call, check out our website, and follow us on Instagram for updated information on services and online resources such as mental health apps, mindfulness and relaxation videos, and more detailed information about specific mental health concerns. Our services will continue to adapt as we work to navigate the changes that will support the health of our Loyola community. All right, so now let's talk a little bit more about your role as resident advisors. And we know that you are often on the front line of support in times of crisis or a mental health emergency, which provides a unique opportunity to sensitively intervene and connect students to support. Students may feel more comfortable seeking you out for help, and today we'll talk about some ways that you can gather information to report to your graduate resident coordinator or another appropriate student life staff member. Some mental health emergencies that we'll discuss include anxiety or panic, severe depressive symptoms, odd behavior, substance use concerns, sexual assault, self-harm behavior, and risk of suicide. So let's start with talking about anxiety. More extreme forms of anxiety is a cause for concern, and some signs include intense fearfulness that impacts a person's daily routine and panic symptoms, such as difficulty breathing, dizziness, chest pain, and/or feeling out of control. When you encounter someone experiencing symptoms of panic or more severe anxiety, it'll be helpful to contact your GRC for additional support and guidance. You might ask the student if they've ever been in counseling before, or if they've been prescribed any medications to help manage their symptoms. You also want to make sure to ask if the person is having any thoughts of self-harm or suicide. Next, we'll talk a little bit about depressive symptoms. And some symptoms of more severe depression might show up as missed classes, significant changes in a person's sleep pattern, increased isolation, and observable changes in the person's appetite or grooming. If you're noticing a resident who's exhibiting some of these experiences, consult with your GRC and ask about whether or not the person is ever engaged in counseling, if they're taking any medications, and also about past or present thoughts of suicide or self-harm. When you notice a person exhibiting odd behavior, this might also be a possible indicator of a potential mental health concern. So we want to make sure that we're not stigmatizing a person's behavior. And some things that you do want to try to pay attention to would include inappropriate paranoia, unusual perceptual experiences, extreme self-confidence, and or a disregard for safety. In this case, it's helpful to notice significant changes you might notice in a person's behavior over time. Again, you're going to want to consult with your GRC and consider asking questions about whether or not the person is connected with a therapist or mental health provider, and to make sure to ask about the presence of thoughts of self-harm, suicide, or thoughts of harming others. When you're supporting a student who may have experienced a sexual assault, it's important to practice transparency and inform the student of your responsibility to report assault due to Title IX regulations. Rather than asking for details about the experience, you want to keep in mind that retelling the story can be re-traumatizing for the person. You'll want to consult with your GRC for guidance and connect the student with a confidential resource such as the Counseling Center, the Sexual Violence Prevention Education and Response Coordinator, or Student Health and Wellness Education. Non-suicidal self-injury is a form of self-harm that is not intended as a suicide attempt. You'll want to contact your GRC to consult immediately to consider referral to the Counseling Center, after-hours crisis line, or a higher level of care depending upon the severity of the person's injuries. It'll be important to clarify the presence of past or present suicidal ideation, plan, or intent, in addition to asking about the person's past or present mental health treatment and or medications. Now that we've talked more about the ways you might notice a mental health emergency, let's consider what you can do to help. First, you'll want to bring up what you've noticed about the person's behavior. And as we mentioned before, it's helpful to use I statements. So an example might be, I've missed seeing you at our floor meetings these past few weeks, and I wanted to see how you've been doing. Focusing on the person's strengths and specific behaviors may be a helpful way to get the conversation started. Next, try asking a question about how the person's feeling. Keep in mind that open-ended questions, like how has it been to transition to campus, allow for more to be shared from the person's own perspective. Closed-ended questions, like have you ever been engaged in counseling, can at times be helpful when we're trying to gather information, but they might also limit what a person may share or potentially communicate a bias. It's okay to check in with the student of concern to see how they're experiencing your questions too. In each encounter with a student or resident, it'll be important to demonstrate empathy by acknowledging and seeking to understand what the person is feeling, thinking, and experiencing. Empathy is one of the most important aspects of relationship building, and considering a person's experience from their own perspective will allow you to show compassion and notice any potential biases that might impact the support that we offer. As you build relationships with the residents in your building, it'll be helpful to maintain appropriate boundaries too. So you want to try avoiding becoming the person's confidant, since you're going to need to gather information and seek consultation from Student Life, the Counseling Center, and other resources of support. And although we spent some time reviewing the range of mental health symptoms that may arise or bring up some concern, you'll also want to avoid diagnosing behaviors and instead focus on providing support, stabilizing the situation, and connecting the person to appropriate campus resources. Here are some tips for stabilizing a crisis situation. And so we've already talked a little bit about this, but you're going to definitely want to try to build some rapport with the student by showing that you care about what they're experiencing. And you might need to separate students to better focus on each person's concern. And also, you're definitely going to reach out for some support from your GRC or an AD, and they can be helpful in connecting with an after-hours counselor if necessary or campus safety. When we think about offering support to the student of concern, it can really be helpful to reflect on some of Loyola's core Jesuit values as a guide. Of course, you may encounter some resistance when responding to a crisis. And it's going to be helpful to roll with the resistance and try to clarify your own understanding of the situation with reflective listening and summarizing statements. It's really important to validate what the person is feeling. So some examples might be, I want to understand what's going on for you so I can figure out what context or resources might be helpful. Or, it's my understanding that you're having a difficult time. Can you share with me what's going on? We've also talked a lot about the need to gather information and share that information. And so you're going to want to make sure that you have clear information about what the student's concern is, any potential risk indicators that you've noticed, such as an Instagram post that names thoughts of suicides, and you also want to understand some aspects of the person's mental health history, like whether or not they may have had a past suicide attempt, are they currently using medications or taking medications, and are they currently engaged or have they previously been engaged with therapy. Try to pay attention to the person's current state of being and notice if they seem compliant, resistant, or disoriented during your conversation. You're then definitely going to want to contact your GRC and share the information that you've gotten and be able to consult for more support. We also want to take some time to consider cultural considerations. And so when we're responding to a mental health emergency or supporting a student in distress or otherwise, it's important to consider how our identities are also a part of the picture. Our social and personal identities are complex and intersecting. For example, two people of the same race and gender may have vastly different experiences based on their country of origin, socioeconomic status, religion, or sexual orientation. Individuals and communities may encounter overlapping and interdependent systems of oppression and/or privilege along these intersections of identity. As you reflect on your role as an RA, consider examples of intersectionality that you've experienced in your social interactions or connections with new people. Think about how might your intersecting identities impact your role as an RA or the way you respond to a mental health crisis. All of us carries within us a script or cliff notes of our society. These can at times be helpful in maneuvering the world. However, they can also lead us to make quick judgments of others, which is heightened in a high-stress situation like a mental health emergency or crisis. It's important to increase our awareness of the potential attitudes, biases, and stereotypes that we might hold about social groups without our conscious knowledge so that we can respond from a stance of affirmation and inclusivity. Our minds process information quickly, which is a good thing. The challenge is to attend to the possible assumptions grounded in stereotypes and oppressive systems. To manage our assumptions, we can take a moment to ask and clarify what a person is experiencing. It's often helpful to consult and seek out the perspective of others as we challenge our initial assumptions and strive to be thoughtful and compassionate in our responses to others. All right, so this concludes the introductory portion of the Responding to Mental Health Crisis training with the Counseling Center. We look forward to seeing you soon for the Campus Connect Suicide Prevention training, where we'll spend more time talking about how to respond to and support students you may work with who are experiencing distress or a mental health concern. Feel free to contact the Counseling Center with any questions that you might still have. And thank you for taking the time to review this video. We look forward to seeing you soon.